Today's our first lecture in anatomy on the planes of the body. We begin the course with the planes of the body and the cavities of the body and the parts of the cell, so that really it's the foundation for the remainder of the course. You'll find out that when we do our dissections, or even if we talk about terminology as far as bones, etc., or muscles, it's all based off of the planes of the body. And these are our three major planes: the sagittal plane, transverse, and the coronal. And the coronal plane is one that they would use if a person needed a facelift, or if a medical examiner was looking first, if they're going to look into the cranium, they're going to remove the skin of the face. And if I use my large saw that my students always love to see, because this was my father's, and if I'm cutting into something, it would be a cut similar to this, and it would keep going all the way through. Or, of course, if I'm a surgeon, I'm using a laser to do my surgical coronal or frontal cut, and they're both, the terms are used the same. For both the frontal cut and the coronal are identical, same planes. So if I'm taking off to do the facelift, I'm doing my cut and then peeling the skin away and then cutting it and tightening it back up. We had a vice principal a few years ago, Leland Brennan, who had many sinus infections over many years, and eventually all of his sinus cavities were just completely blocked. And so he needed to have those drilled back out again, and they did that frontal or coronal cut, took the skin off, drilled out the sinus cavities, and then Leland, at the ripe old age of 60-something, had a facelift free of charge. I also make for you a little pickle person or a little apple person, and today I've done a combination of all of those. And if I have my little apple person, and I give him legs and arms, my little apple person, my coronal cut or my frontal cut would go this way through the skin, and it's not easy to cut this way, and then I could peel off the skin. So why don't you give that a try, coronal or frontal. So when I ask you what is the coronal or frontal plane, this is what you would be giving me, something to that effect. Then we have the transverse plane, and the transverse plane is interesting in that that's the plane that you would be thinking of if you went to the magic show and you saw the magician put their helper into a box, and they laid them down, and then they started to saw them in half. So that would be your transverse plane. And if I stood up and again take my father's old saw, it would be back and forth this motion. So you could actually remove or cut the person in half through that. And I would say one of the more common times that a transverse plane would be used is removing a kidney. We had a teacher who's retired now, Mr. Moore, and Mr. Moore had a brother-in-law with failing kidney disease, and he was a blood match and a protein match. He offered his kidney to him. And so what they do to remove a kidney is that they would take and do the transverse cut, and then a second cut, transverse cut, and this is the back of the person, and they would remove the kidney that way. So the transverse cut is cutting that person in half, or making a incision that is sideways or horizontal. Our third plane of the most common planes is the sagittal, and please pay attention to the spelling and that it has two T's. It is also called the midline or median, and you'll find that that is used more often than anything else in science, or what we are doing with our general anatomy class. And the reason being is that often a person who's had a brain trauma or a massive body infection, virus, for example, where they've been on a ventilator for a while, again, the people would have problems, or stroke, they have difficulty. Their brain has gone through a trauma, and their brain now does not recognize what is upright. So a person can sit up in bed fine, or they may be even slightly leaning one side or the other in bed and not even realize it. The brain doesn't recognize that they're tipping. And so what a physical therapist or an occupational therapist, the nurse, the LNA, or the doctor, any healthcare provider is going to be helping that patient train their brain to understand what is midline or median. And oftentimes the occupational therapist or the physical therapist is going to be using a room with mirrors, and you can get the patient out of a wheelchair upright using a lift belt, which is a large belt that would go around the waistline. And the nurse or the occupational physical therapist can pull up from the back of that lift belt, assisting the person to stand and then making sure that they don't tip over. I have the story of that when my mother had a major stroke. Two former students who had become LNAs, I asked them over to the house. I brought her home for the day when she was in physical therapy for her birthday. And I knew that they were certified and could give assistance. And my mother did fine out of the chair and into her walker. And I had the LNAs on both sides. When my mother decided that she wanted to go take a look at her kitchen and how I had rearranged things, and she turned quickly with the walker and was not yet aware that she had lost her balance and started to go straight over with the walker. So without those trained professionals beside there, my mother would have ended up on the floor. So let's take a second and review our 3 planes. And again, I would be practicing this where the coronal plane goes this way. And so if I had to take off, for example, the front of a mammogram, not a mammogram, excuse me, the mammary glands, I could do a coronal, a coronal plane, yes, thank you. And if I had to do a kidney removal, I would be doing a back and forth this way, but on the back of the body. And that would be your transverse plane. And again, if I'm assisting that person, I would be using the sagittal plane. So again, practice that. And here I've created what I like to use at the house if I'm helping somebody review, and that I've created a little apple anatomical person or a pickle anatomical person or the marshmallow. And again, what I would have you do is taking toothpicks or some other little device is to put a toothpick in where the coronal plane would be and to tag that and actually explain to yourself the coronal plane is this way. I would use it for a coronal cut if I was doing a facelift where I'm going to do a front plane and remove it. And for example, I could also do with a pickle person or the apple person, I could do that transverse or horizontal plane that is side to side. And I could also do the midline or the sagittal. There are also some that we haven't discussed yet, but here I show you my picture of a coronal cut and the sagittal or the midline or the median cut, all 3 terms meaning the exact same thing. Here I'm having my poor apple person getting cut in half. That's my transverse or horizontal plane. And one we haven't talked about is the oblique sections. Oblique is not often used in anatomical terms because in medicine they're discussing how they're going to do surgery. The surgical team will review before they begin what kind of a cut they're going to do, and oftentimes if it's abdominal surgery, they're going to do the sagittal cut on the abdominal cavity. If they're going to be removing the kidney, it would be that transverse cut. And then they're also discussing on how they want a CAT scan or an MRI taken. And so that's where the oblique gets to be a little bit more difficult because that's an angle. And so if you think about it, there's an oblique muscle that sometimes you might have learned about. Or if you're running at an angle, like if you're playing a football or soccer game and you're trying to get that ball off at an angle, that would be the obliques. And here is a review of our first lesson. And here it is where it is one picture and they're showing you all of the different terms that could be used. And I've even broken down the sagittal or the midline a little bit further. So here we have first the coronal. This is going through the head, through the body, that way, also known as the frontal plane. Then we have the horizontal, or the transverse plane, again, starting from the posterior part of the body. If you are removing a kidney, you're going in through the back, but you would be doing that transverse plane. It's also called the horizontal axis. And then our third, our sagittal, also known as the longitudinal plane. Can also be broken down a little bit further. So let's say that you are a Hollywood movie star and you've decided that you're going to have implants in your thigh. Can't recommend it, but they could be making what is called a median plane, or inserting extra tissue in the interior of the thigh. So that would be a median plane example. In a parasagittal plane, that's exterior of the midline. So here we have midline, and here I'm following that nice yellow. Inside of that would be the median. Outside of my middle would be the parasagittal. For example, if I needed to open up the shoulder and take a look at that, or if I needed to open up in the pelvic area and take a look at that, I would not be doing that midline, the abdominal cut. I would be doing that on the opposite side. It still would be a longitudinal cut, but it would still be a little bit different. So those planes really have to do with how the body stands or how the body is cut. And again, that sagittal will end up being one of the ones you're going to use more often. If you can imagine watching those CSIs or the medical programs, and you see that the medical examiner would have done a longitudinal sagittal cut through the victim so that they could take a look at all of the abdominal tissue. They then would have done 2 obliques, one at each angle, up here at the upper part of the body, to make the Y cut, and then at the very bottom of the abdominal cavity, they again would be making 2 obliques to be able to open up that entire tissue. So that's another way of looking at those oblique sections. Please review all of that at home. I would practice several times. This would be similar to a picture that you may get on a test that you would have. And again, if you have questions, please just email me or let me know. Thank you.